e-health support unit is comprised of different programs and different projects across Africa, implementing projects that are supported by technology, so either for training of health workers or supporting the practice of health workers. Much as the e-learning program has increased access to training, we're saying there's still a gap in terms of the people out there who can still not be reached using e-learning. So the new project that is made possible by the Dutch Postcode Lottery Fund is trying to look at what devices do health workers, nurses and midwives and so forth have to provide for them access, increased access to training. The pervasiveness of mobile phones, for example, all the health workers, we've done a survey like in Kenya, and all the health workers actually have a phone, a mobile phone. And many of them also have other mobile devices like tablets or smartphones and so forth.
We are going to launch this by using the IT. Why? Because it is IT based. So allow me now to go through the process. You remember, it is IT based, and I feel excited. Some steps I'm taking here. So you also log in and you will read what. So I read, we are now launching this important program. And this is the message I've got. I now declare the Dutch Postcode Lottery supported mLearning project for nurses and midwives in Kenya, Uganda and Tanzania officially launched on this 28th day of August 2012.
So this new project will be carrying out research to find out if we provide additional reference materials for the nurses and midwives. Can they perform better? Can they access better knowledge and therefore provide a better quality of service? We also want to see if the use of mobile devices can encourage peer-to-peer learning. So if a nurse, if it is in Kenya, for example, if a nurse is in one region and maybe facing challenges that they have never faced before, can they collaborate with a fellow nurse in another region which has that challenge and has already found ways of coping with it? So how do we encourage the health workers to speak to each other, to share their knowledge and experience to improve the quality of service?
Product is taken us from electronic learning, now we're going to mobile learning. So with technology, it is good. The impact, of course, is going to definitely be there because, you know, we already have experience with the electronic one, but this one is mobiles.
We want to shift to e-learning using these mobile phones and the like. We think this will help us because, you know, people are there, they have phones. Yeah? It's just a matter of programming them. You communicate through telephones, giving them information, they give you feedback, you assess them, and continue with training.
E-learning has surpassed my expectations. When we started, I thought we would only have maybe 1,000 people, and we call it quits, but it has surpassed my expectations.
The important thing in training is whether the teacher is there, the instructor, whether the learning materials are there, and some physical structures are there, but with also e-learning system put in place. That is where now we think at least competencies will come out of this learning. And those are the many areas which we think we need to put more effort in, because if you cover that, then you know your product will be competent.
This is actually a very exciting program because this program is going to enable most nurses who cannot travel to go to classroom to be trained. They will be trained using this new product. This is actually designed for the nurses, and so it will bring in all the nurses right from the community to be trained. Specifically, if they actually want an upgrade, this is the way to go.
We started with print materials in 2004, and I knew that was it. When we went to E, we were thinking, will it work, will it work? It worked. So the M we are starting today, I am sure it will work. Why? Because how many Kenyans don't have mobile phones? I don't want to talk about how many have. How many don't have? It's something that is accessible, and I think will reach more people. And I think the turnaround time, asking questions and getting responses will be very fast, faster than the E, because the E we have been doing is materials that are deployed into computers. But this one, you are able then to communicate more freely. So I'm thinking it will be accessible, I'm thinking it will be interactive, and I'm thinking it will revolutionize nursing education even much more than the e-learning. What has made distance learning very successful in Kenya, for example, distance learning in general, is that people are doing, for example, researches, and they are implementing on the areas where they are working. So people get benefits, that. And that will even be better with the mLearning.
E-learning, first of all, is greatly welcome to Uganda now. We have conceived the concept, people are embracing the concept, and already we have a huge interest from the potential learners. So now that we have walked that challenging route and perfected the hiccups that we had, we know that it's something that we have already overcome. So when we bring in the mLearning, it's going to bring on board more learners, help us quickly train, improve the quality of our health workers, and improving the quality of our health workers means improving the quality of health care.
To the donors, this is the best thing that you have done for us. We have moved mountains. We don't know how many nurses are going to access this learning and what learning will do to our communities. Please go on, ask more people to come and just support the nurses of Kenya so that they can help the patients that we serve.